So, what are some of the risk factors for physical abuse? Again, sometimes these can be for maltreatment or neglect too. So, inadequate bonding. So, in other words, the children can be perceived as difficult children for a number of reasons. They don't, maybe they're born with some learning or psychological problems. Okay, maybe the mother is experiencing postpartum depression. Okay, maybe the child doesn't come out looking like the parents thought they. So, just as a review, physical abuse is beating a child to the point some physical damage is being done. So, non-accidental injury of a child that leaves marks, scars, or broken bones. Okay, so things to look at. You also have to look at for physical abuse. Where is the mark occurring? For example, children do not usually have marks on their buttocks or the back of their legs. So if they do that, it's suspicious. Sometimes a handprint across the face, and sometimes that can be what's known as fifth disease. But many times it can also mean that a child is being hit. So you have to know a little bit about and what is the pattern of that physical abuse. And risk factors for physical abuse, and actually for it can be for neglect too. So 28% of children between birth and 3 years are neglected or have physical abuse. 24% between 4 and 7 years of age, and 23% between 8 and 11 years. So the highest is between birth and 3 years, obviously, because the children they cannot tell you what is wrong. So some behavioral indicators are they're afraid of adult contact, obviously, because adults are always hitting them or yelling at them or something like that. They're apprehensive when other children cry because they think, oh my gosh, I'm going to be the next one. They have behavioral extremes. They're really happy or really sad. And again, you have to look at the age of the child. You have to look at the background of the child. And then you also have to look at the frequency. How many times does the child display this behavior in a week, in a day, or whatever time period you see the child? And then they're afraid of their parents, obviously, or other caregivers who are abusing or neglecting them. So they're living out of fear rather than living out of safety. So these are some other behavioral indicators. And again, if you can observe and get some kind of behavioral indicators, that's always kind of the best way. So children are afraid to go home or afraid to go to any of the places that they've been abused. They seek affection from any adult because they're desperate for love. They're hypervigilant. Hint, hint, this may be on your test. Hypervigilant means they're always on alert because they're used to being yelled at or hit or something's going to happen to them. So they learn, how do I keep myself safe? And again, adults are the ones that are supposed to keep these children safe. They have an unusual adaptability to people and settings. Again, they think, oh, if I just sit quietly, if I do my homework, if I don't make a lot of noise, perhaps I won't get hit or I won't get yelled at. And then an inability to enjoy life, and sometimes they're passive. I worked with an older woman who, when she was 3, her baby brother was born, and her mother said, sit in that, and her baby brother was had some health issues. Sit in that chair until I tell you to get up, which was about, she would say sometimes a half hour, sometimes longer. So she learned to kind of be passive. And I remember one time I asked her, well, what makes you happy? And she said, I don't really think of life in terms of being happy. I think of it in terms of being content. Content. So, sometimes children have that kind of sort of taken away from them. They can't get excited and they can't get happy because they have been, abused, and they turn into individuals who are passive. So this is a short clip I wanted you to see about a CPS worker, because I think sometimes CPS workers get a bad reputation. So I kind of wanted you to see what they go through. And the reality is the federal law says that if the situation is workable, that CPS workers have to make every reasonable effort for family reunification. Okay, so now if the family's not workable, if there's some big issue and the child's not safe, of course they need to remove the child and look to have the child permanently reviewed. Okay, so again, you just hover over it and click, and hopefully the YouTube video will come up for you. So another form of child abuse, child abuse, can be Munchausen syndrome by proxy. And Munchausen syndrome by proxy means the parent or guardian intentionally harms the child to get attention from others. So often, some of the causes can be they may be rejected by others. It can cause rage in a parent. The parent may be unable to differentiate herself from the child, which means maybe she hasn't got some of her needs met before she had the child. There's a very high profile case actually in Schenectady County called Mary Beth Tinning. She was a woman who had a few of her own children, and then she adopted some children. And what she would do is that the children would stop breathing because she'd put a pillow over their mouths, and then she'd call 911, and there'd be all this commotion. And at first they thought it was SIDS, sudden infant death syndrome. And when I think 2 or 3 of her own children died, they call it SIDS. And then once or twice, one of the adopted children died, and of course SIDS can be genetic, and then they were very suspect, so she was found guilty of murder, and she did go to jail for a very, very long time. So again, it is a mental illness, and Munchausen syndrome by proxy means you're doing something to somebody else to get attention for yourself. So another terminology is called failure to thrive. So children can exhibit failure to thrive symptoms, which means they're under the 5th percentile in both height and weight, and at one time they were within the normal range. Now again, you have to look at the biology. Those of you who know me know I am vertically challenged, i.e. short, and I certainly had enough to eat growing up. Our family loves to eat, and we're always eating. However, it could be that the child is just going to be small genetically. Again, so you have to look at that. Maybe the child is perhaps allergic to the formula. You can also have non-organic failures to thrive, which means the child is not receiving enough love and or attention. Okay, children can physically not grow because they are not receiving enough love and attention. Again, so when you are the child protective CPS workers, social workers, you have to be able to ask all those, remember those wonderful open-ended questions we could ask in class, which I so miss having you do. You have to know details and what are you going to ask the parent so that you can determine, is it one of these factors or is it something else? So this starts a little bit of the advocacy portion. So, we're in the middle of the pandemic and you're looking at, the governors and the president is trying to put in different, laws, extending rent payments, extending unemployment benefits. That's all advocacy. That's all on a systems level, which hopefully is going to affect us positively. So, the Child Abuse Prevention and Treatment Act was enacted in 1974. So just so you know, I know many of you weren't born then, but the Society for the Prevention of Cruelty to Animals was enacted way before, it was in the 1800s, which is way before 1974. So children do not have a whole lot of rights in this country. So what the Child Abuse Protection Act, the Treatment Act says, it provided for direct assistance to states to help develop child abuse and neglect programs. So in other words, it mandated that each state had to have some child abuse and neglect programs and provided some money. It also established a state central registry, which, better known as the Child Abuse Hotline. Before that, there was really no place that people could call in order to make a report. So again, I just wanted to show you something positive, children who don't end up with their biological parents, sometimes it is better for the child and sometimes it is, beneficial to the child. So just click on this YouTube and, just watch it for a couple minutes. Again, hover over it with the mouse, the hand should come up and just click. You may have to be patient. There may be buffering issues or something like that. And then with any other kind of laws that are passed, they keep being revised. So in 1980, you had the Adoption Assistance and Child Welfare Act of 1980. The PL stands for Public Law 96-272. And what this law did, it provided federal support for children in foster care because, again, you have city funding, county funding, state funding, and that's not often enough. You need to have some more federal support, so that kind of levels the playing field for all of the states. So there was some additional money and programs for children in the foster care system. So states had to have a plan for placing children in a permanent home in a reasonable amount of time. Now, if I asked you, what would you think is a reasonable amount of time? Usually the answers range from 6 months, a year, 2 years. So again, that was an issue too. What's a reasonable amount of time? And it also provided an extra subsidy, extra money, so that children who had special needs could be adopted also. It was kind of an incentive. So that still stands today. If you adopt a child with any physical, emotional, psychological problems, you will get some extra money. By the way, speaking of money, excuse me, I had a friend who had 67 foster care children, not all at once, of course. But we, divided the cost up because remember, when you're having foster care children, it's 24/7. And it came out to probably about 50 cents an hour, okay? Today's world, maybe 75 cents a dollar, all right? So if you really spend all the money on the children in foster care like my friend did, it isn't nearly enough money. My friend she'd have the same birthday parties, presents, take them on vacation, everything she did with her other children. So it's kind of a misnomer out there that foster parents make all this money or cheat the system. Remember, those are the only ones that we really, really hear about, not the ones like my friend that are really providing a good home for children. So again, when laws are enacted, they keep needing to be revised. So in 1997, there was the Adoption and Safe Families Act of 1997. Excuse me. Better known as ASFA. So what ASFA did is it adopted a child's chances of spending less time in the foster care system, less time not knowing what was going to happen, and increased their chances of being adopted. So basically what this law said is after October 1st, 1997, a permanency plan hearing was required for children who have been in state supervised out-of-home placement for 15 out of 22 months. So that includes foster care homes, that includes residential settings like St. Catherine's, so anything. Again, so what this means is specifically either the parents, but it's not usually the parents, the judge or the caseworker can start what's called a TPR, termination of parental rights, if it looks like children are not going to be reunited with the parents. But again, excuse me, but again, the law says you have to make reasonable efforts to reunify. So usually you don't start a TPR, termination of parental rights, unless parents have, like if they like, let's say the judge said, you need to do a year of counseling sessions or rehab or something to help your drug use disorder issue. and they consistently have not done that, all right, then they can start a TPR. I assure you, usually it is not started exactly in this time. It doesn't say it has to be started, but you have to go before the judge and say, what is the plan for the child that they do not languish in the system? So that's what kind of permanency plan means. So again, when you look at reasonable efforts for family reunification, again, parents have to be, biological parents and the child have to be provided enough resources, okay, resources. So counseling, maybe it might, do they know how to use the bus system? Do they know where the food pantries are? Do they need some job training? Do they need to go back to school? So any resources that would help them be able to live a healthy life with their child. So reasonable efforts. And again, that is a very sketchy term. Because some judges will say, well, the parent needs 3 years or 2 years. Some will say, after a year, 15 months, you haven't done what you're supposed to be doing, we're going to start a termination of parental rights. So that's still a little bit subjective. So again, permanency plan services, meaning if the child is removed from the home, or even if he isn't removed from the home. So what is going to be the permanent plan for the child? In other words, what is going to be the end result? The other aspect, this law states that if the child has to leave the home, they must leave and be placed in a least restrictive setting. What does that mean? Least restrictive means that the particular child is, where will the child flourish? Okay, in other words, will the child flourish in a home setting, or are there issues too complicated that they need to be in some kind of an institutional setting? Now, children who have been sexually abused oftentimes are in a foster care home with no other children. And with foster parents, they have to be specially trained in how to deal with these particular children. So in other words, it means, where will the child thrive and grow mostly and to their full potential. So I wanted to end with something again on a positive note here. Okay, so this is a different adoption story than the one you previously looked at. So remember, the point about learning about neglect and maltreatment is to be able to say, how can I help the child? Okay, some of these facts and looking at some of these are not pretty or enjoyable, but the more information you have, the more information you could help the child and the family. Okay, in the video that you're going to see in Thursday's class, it's called Child of Rage. It's a true story. It's a little bit older. But I really, what I liked it is that it showed how people were patient with the child and how the child can actually, live a healthy life even with the terrible abuse that she encountered. Okay, so the Thursday class, again, you'll have the video to watch, a worksheet, which please send me by email. Please try to do these in a timely fashion. We only have 5 weeks left, and I do not want anybody to get behind. Okay, take care, and it's sunny here today, so try to get out, take a walk. Of course, remain your social distancing. And I miss all of you, and remember, contact me with emails, anything possible that you need help with, and I'd be glad to assist you. I really want you all to get a good mark in this class. Okay, take care, and I'll probably talk to you in the next week.